Recently, we created the Intermountain Continuous Improvement Method, and the idea behind the method is to create a framework for systematic improvement throughout the organization. There are 7 key systems, and of those 7 key systems, one of them is strategy deployment. Strategy deployment means what does it look like to be successful and improve the work? And so within strategy deployment, we have a key element called Huddles. People are coming together in ways never before to improve the work that they're doing on their very shift.
Huddles provide extraordinary care because it's a chance for our whole group to come together and to talk about different issues or problems that we're having.
Helps us to just function better as a team, so we know, if there are safety risks that are coming up, our confused patients, staffing issues. So it's really that opportunity to share information with the front line and just function better.
It helps me to feel validated as far as my opinions that they count. We're trying to work together to achieve the best outcome possible. And just to know the motives is huge. The motive is improvement. It's not anything else.
There's been many times that someone's come up with an idea and I really have thought, why didn't I think of that? Oh, that's a great idea. I can see how it would solve this problem and make things so much easier maybe for a family member or so much easier for a patient.
For me, it's also a standardization of best practices. In a climate where we're trying to always follow those best practices and standardize our care, it's hard to disseminate that information. The huddles give us a more timely fashion that we can say this needs to be pushed out to the staff right away. And if we do it in huddle, it's going to be faster than any other form, even emails some don't read.
It's nice to see the numbers or where we're at, and it helps people to know that this is what we're shooting for and this is why and this is how it benefits the patients, and that makes a big difference.
So what the Huddle board has allowed us to do is to put up in front of people actual stats and say, here's where we're at. And in some cases, here where you personally, here's where you're at. And once they could see what their raw score was, they came to us and said, how can I improve? What can I do better? They were able to act on that. As a result, we've seen safety scores improve about 39%.
I see people constantly saying, my numbers are here, and someone who's slightly above will say, here's the little thing I do that makes that different, that lets me get done a little faster. Here's the little steps I take. So it gives the team a chance to kind of work together and cooperate and improving each other's outcomes.
They're part of the problem solving. Their input means something. In fact, every great thing that we've done, if we've made a change, has come from the people that actually do the work.
Over the last year, we've been able to save about $40,000 in expenses on our fleet. And that comes as a function of people driving safer because they look at their safety scores more frequently.
We're all in the same boat, and we're all trying to solve the same thing, and we all have a mission to get that done. We want to make sure that we put the tools in there for that success. And the Huddle board is a great tool for that success.
Implementing the Huddle, our visual tracking board, and just the great team we have and how we pull together and help each other has been a huge win for us. I feel we're much better organized, we're much more able to really connect with each other and get things done faster.
A Huddle's a good way informally to bring up your concerns. So, like in a non-confrontational kind of way, you can just be like, hey, I saw this on this report and it doesn't look right.
We can check with each other to see if in the past somebody's already done something similar, and also if they can give me some tips and some pointers, things to be aware of.
One of the things that came up in the Huddle is that the data fields we had in our task tracking system weren't specific enough for what we needed. Ernest found an opportunity to use some of his programming skills to improve that and help us all do a better job. And the Huddle has been a really great way that we can continually improve that, make it better, and it's helping us be more organized in how we work.
A Huddle actually allows you to hear things a few times, and so it can soak in, and you can make connections in your brain to things that you haven't made connections before.
It makes our unit flow better over the course of the day, just getting that information out as a group in the morning.
When we first started to do them, I thought this will never work. There is no way that we can take that amount of time After you experience them, you realize the power of them. And that it's in that taking of that few minutes at the beginning that then you're able to shave off time later in your day because you have all the information you need.
Healthcare, nursing is a team sport. Nobody does it alone. And I think the Huddle is kind of the embodiment of how that sport is refined and played. So we're all working toward the same objectives. We're working toward that same goal.
Huddles are a powerful element of our continuous improvement method that will elevate care and improve patient safety and outcomes.